Greetings, everyone. Thank you for joining. Thank you for seeing each other. Thank you for these embraces. I will share this group that the first time I worked with the military personnel. It lasted 3.5 months. The group worked at the rehabilitation center for veterans, and there was a need for that. The changes that happen, they need rehab. There was a layer of knowledge needed for the group to come together. Communication has improved in time, and there was a possibility of rehabilitation for the military servicemen and women. Attending a physician was taking care of what to study. I was conducting musical therapy part Tuesday and Thursday, art therapy, and psychoeducation. My first impressions when the group arrived. One woman out of the group of men, from 22 to 56 years old. Thank you. The group was has plummeted into themselves. I realized at that moment that it was not as good as it is gonna be. Perhaps the most important point was that we needed communication and meeting between them to take place. So let's discuss how we worked. It was important for me to understand the structure of the individual. Next slide, please. Here are we had the psychopathological people who were rude, aggressive, breaking the rules, changing the time frame. It took time to structure our work. They were rather aggressive and arrogant. So, which means that they were not using their words to express what they're feeling. Aggression was directed as well. There were anxious personalities. Based on based on their low self-esteem, they always wanted somebody to be around. There was a problem with sitting in one place. Somatic anxiety symptoms were happening as well. Steroids, the female patient was able to switch the attention towards herself. She would cry, and then once she would get the attention, she would stop. So it seemed like a mechanism that she had.
So this patient had very difficult relationship with her family, and we also say that patients were dependent. It's not only about addictions. They had to speak about their needs and wishes, but they found it very difficult. And they were very needy. They needed someone all the time. They asked, can I sit next to you? Or can this person be here? So there were many patients, clients who came with such problems like neediness, dependency. Also, there were brain function disorders, concussions, hypersensitivity to sounds, and at the same time, their hearing ability deteriorated, and they also couldn't perceive reality in a clear way. Sometimes they couldn't repeat what they heard. Sometimes they misheard something or didn't hear fully. And they reported that they used to have good memory, but their memory is not good. And also different bodily symptoms that showed up during the work. We could see such symptoms as some impulsive movements, and also they reacted pretty intensely to what was happening. Also, very often there are depressive episodes. The patients reported losing hope or interest in the future or in anything. Also, they lacked taste when they ate food. For example, they reported enjoying food before, and now I don't enjoy the taste of the food. Also, there are reactive depressions. So when I was preparing for a session, a loss happened to the patient. And now I would like to speak about other processes happening in the group when the person signals about the fear. It's very important to normalize that, to allow a person to speak about it. And during the work, for them, music was very relaxing. And also the patient reported that for the first time during many days, at least for 1 minute, I could feel what relaxation is. And I would like to share a tool how we can use it in a very tender and delicate way. And when I could see the interest from the participants, I realized that we can try to do something like that. So the patients also try to isolate themselves to avoid the contact. They came up with all the excuses. I need to go to the toilet, I need to smoke a cigarette. And of course, we cannot say no, you cannot. And then we ask to the person, can we then wait for you while you go out? So the person went to have a smoke break, and it only lasted 1 or 2 minutes. And then the group was waiting for this person to come back. And this is also an opportunity to have control, to speak about my needs, that I need to go to have a smoke break. But I'm not only responsible for myself, but also for the group that is waiting for me. Also, we speak about helplessness and other symptoms. For example, they said, if you need something, do, or let's do how you tell it. So they didn't say what they wanted. They would rather give this initiative to others. Do whatever you want, do whatever you need. It means that we can take decisions and we can delegate it as well. And through music, the patients start to feel themselves, their bodily sensations, their symptoms, like, for example, chills or goosebumps, or when the drum was beating. So how the body reacted to listening to the music. So we are listening to what's happening here and now, but sharing it meant that there is trust established in the group, that the group is ready for that. And also we speak about dissociative symptoms. I could see these elements of dissociation in our work. And this could happen even on a train station, like in the middle of the city, when the person reported not remembering anything. And we need to explain in a psychoeducation way what it is, how to deal with this. And then we need this reaffirming, I'm here now. I have an ability, a possibility to be fully present here. And it helps in acting as well. So when we work in the group, we worked around 1 hour. I also spoke about isolation. The patients didn't want a verbal contact, but they also reported not being happy with anything. They say we want to stop treatment, but we cannot choose to opt out. And they said that we are not happy with the setting, with the format, with whatever. And then they also accept the suggestion to build a relationship with each other, the cooperation with each other. So I try to engage them into like community building. Also, we speak about the guilt. They say, for example, I feel bad, I sing, I play. And then they were surprised. Oh, I can really do it. That's great. And there was a moment where one of the music instruments played. I want to share something else, how we work with traumatic experience. And how this feeling of being able to be together appears in the group. That we can do something together. And they realize that it is possible. Yeah, we are running out of time. I would like to show you a video clip. Maybe you have seen it already. But it's important to feel your rhythm. It was a quote by French anthropologists about the role of music in our lives, how it can express emotions and feelings through melody, through musical elements, and how it is also part of our social and cultural life.
There are 5 centers of psychological help, and there are opportunities to access psychological and psychotherapeutic work. People work and has been working for some time now. Mostly the requests are there's no hope for the future, nothing to wanted to do. If sorting out the technical part. Based on the problems and requests of the personal nature, most of the 70% of people never had experience working with the psychotherapist or psychologist. 90% are people of female nature. The art center works in the art therapy way. There's one center specialized for kids. So we provide our locations where the youth can get their help. And mostly it's word of mouth. There is access. All right, so I will describe to you what the video is about. I'm concluding my presentation. We need to listen. We need to care for ourselves. Once we do this, we will be able to care for others. I wish all of you the ability to take care of yourself or oneself. Thank you.